conduction system. So there were several sites of PVCs. They were, at least two of those sites were challenging in two different ways. Okay, so one of them was right next to the tip of your ICD lead, where he was concerned that if you played right there, it could cause dysfunction of the device, and they need to do some lead or do surgery on that. The other is one that was fairly close to the main electrical conduction system of your heart, and if we damage that, then you end up becoming pacer dependent, or at the very least altering electrical conduction in the heart, which can actually lead to heart failure, right? So neither of which do we want to do. So I think he held back a little bit.
It seemed like he said it was very deep tissue issues.
And in the septum also, yeah. So that second one that I was talking to you about is in that wall of the heart that separates the right and left side. Sounds like he did all the work just in the right ventricle. And so at this point, do you feel any better? Are you having less arrhythmia than before? Do you have a sense of that at all? Or
sort of. I mean, I'm still kind of having this issue with chest pain, where I'm starting to be like, maybe it's not related to my heart and it's something else, because but then, okay, so what happens is I get a tightness and it starts like a level 2, let's say, and it progressively gets to like a 10, where it's absolutely the most unbearable thing, but it lasts like maybe like from start to end, because then it reaches its pinnacle, it stays there for a while, and then it's like it slowly releases again.
It's like a 5 to 10 minute ordeal.
That's strange. And as far as you can tell, does it correlate with arrhythmia in any particular way?
I don't know, because I don't ever really feel
it.
You know,
a couple of times when I remember, I tried to go push the button on the modem.
And I was having them like
device.
So
yeah,
this is
it's hard to catch that on time. Yeah,
heart failure gave me. I did like a 30-day monitor, hoping to try and capture one. Didn't, so came off of it, and they were like.
Yeah, it was in October, right?
Yeah.
Yeah.
And then it got to where I was having like 3 or 4 a day.
And has that changed at all? Or
so I'm not having them as often since the ablation.
Okay.
But I would say at least a couple times a week.
Yeah, still.
She did one Valentine's night. She did one, I think it was before her ablation, where we walked into the grocery store and got we parked and then walked in, and then we were like a couple aisles in, and it happened to her, and then she was laying on the floor in the grocery store for like a couple minutes. I'm like, it's okay. People are looking at her like wanting to call. And I'm like, it should be okay, but like, for me.
Do you feel lightheaded and dizzy at the same time? Or
and nauseous.
And nauseous, like all at once. Then it goes on for several minutes. Is that right? Because you have some arrhythmia, but none of it lasts that long. Although it's hard to say if you're having a whole bunch of PVCs at the time, because your device won't record that either necessarily, right? It records sustained arrhythmia.
Right. When I was in here in December, I think I saw your PA, or maybe that's when I saw Bunch.
I think you saw Bunch. Yeah.
Okay. And so a couple of times, like I'd written them down, and they were like, "Well, you're having a bunch of PVCs, but that's."
And that really could be it. Yeah. And it is possible though. If you're having every other beat as a PVC, then during that time, those PVCs often don't cause much of a pulse, right? Because the timing is such that your heart doesn't have much time to fill with blood. So, if you're having PVCs, you'll go along normal, and then the PVC will come in quickly, right? And again, if you're looking at EKG, there's an electrical signal, and if you're watching the heart on ultrasound, it would move, but there's not much time for the heart to fill with blood, so often people feel a pause, actually. They don't feel necessarily the extra beat, will be a pause in their pulse, and then there'll be a little extra time as
we noticed that
blood, so.
Because we have a pulse oximeter, granted, pulse oximeters are cheap, but shitty waveform or no waveform when some of this stuff's going on, and then we'll slap it on my, and then boom. I have bradycardia when you see a nice rhythm on her. It doesn't give you anything. It's all jacked up, and then when she feels
she's
better,
having a bunch of PVCs.
That has a rhythm.
So, and the issue there is that if your EKG says 70, but you're having every other beat of PVC, your body's going to feel 35.
Right.
Okay, so I think that would account for you whether that causes pain per se or, the dizziness and all that, everybody's different as far as that goes, right? And so I think that, if there's no other good reason for it, it may indeed correlate. I know it's kind of hard to pin down. And he clearly did some ablation, but he also is under no illusions that he got rid of all of it, right?
Yeah.
And so I think that's you having a partial improvement is probably about right.
That's kind of what he was saying too.
And I guess the question of the sotalol is purely one of quality of life, honestly. And so, again, your life-saving device is in your chest, okay? So if you feel like the sotalols make you feel crappy, and it almost always does.
Well, I'm doing better
You're getting used
at
to
the
it?
80.
It lowers the
He
dose.
put me at 120
Oh,
and I
you're
was
on a
taking
higher
like
dose.
60 in the morning, 60 at night.
Okay. So
And
you're
that
just
was-
40 and 40.
Yeah.
Okay. Yeah. So it's universal sotalol causes fatigue as a side effect, and let me check the other meds real quick. Because, I think that there's nothing magic about the stuff. I've never even heard of anybody who lived any longer because they took sotalol, okay? Or any rhythm drug for that matter, okay? So
you're treating symptoms with any of that, the toprol, the sotalol. It's just,
toprol's a little different. Toprol probably does help the heart muscle stay happier over the years, okay? So I think that probably is more important. But the sotalol is truly for symptoms. And I think if you feel like your life's better on the sotalol, then it makes sense to take it. If your life isn't, then maybe it doesn't, There's another alternative, which would be to have you come in the hospital for a couple of days to start Tikicin, which could probably give you a higher dose with less side effects. But you have to be in the hospital for 2.5 more days to start that sort of thing. And we don't really know. I always struggle with the same thing in the same procedural situation where you've been partially successful.
I really.
Do we put you on some meds now? But then if we do we really know what's causing where you are now? Is it the med or the procedure?
Yeah, because you gotta give it time, right?
Yeah.
so now
you're
acting like it could take a month
2
or
to
2
3
months
months,
for the
even.
heart to heal from what he did in there.
Could be.
Just because
And you're a month out now, right?
Yeah.
So, I wouldn't be opposed to you stopping the sotalol for a couple days and seeing how you feel. It takes 2.5 days. The way medications work, it's 5. Yeah, exactly. It's 5 doses or so, right?
But
take
would I
that
be
one
it's like
pill, we
2.5
got
days.
72 hours. I'm just kidding.
Would I be okay to, let's say I do that and not go back on toprol for right now too? Or
my preference would be that you take one or the other. I think long term, especially, I'm sure the Kia and company over there.
I actually
toprol or.
liked. It took me a while to adjust to the toprol,
But
She
Yeah,
likes
you
the
should.
toprol.
but I was totally
Fine.
functioning, working out, getting through my day.
Yeah.
You know what I mean?
I would go back to the toprol.
Okay.
Yeah, and I think it's fine to just stop one day and pick up the toprol the next. Do you still have the toprol prescription?
I probably still have some.
Do you remember how many milligrams it was?
I mean, if I was at home with my little medicine cabinet, I'm sure I still have the bottle.
Let's see. We can look back.
Previous note, yeah.
Yeah.
Metoprolol 6, 50.
I was gonna say,
50
I
once a
wanted
day.
to say
Mhm.
50.
Yeah, we take it.
So
You
once a
take it
day?
in the morning.
I take it at night.
Yeah, good. Yeah, that's how I typically do it for that. The other
So like
thing.
I took my 40 milligram xylitol this morning.
Mhm.
I could just not take it tonight and take a toprol tonight and it's not like gonna mess me up. I did not super loving the xylitol. So whatever, I always want to put him on.
We thought it was killing her one night, and we called in and talked to one of your PAs on the phone, and that was freaky. That's like the other thing too. Is like
What's
That's when they switched
that's
my
when
dose.
that's when she was really a higher dose.
It dropped my heart
Oh, the
rate
120,
really
yeah.
bad, and I was like,
Well, and you're not
idiot.
programmed to pace fast, right?
Yeah.
You're programmed to not pace you, right? So, yeah, that also potentially make you feel
It made her uncomfortable. Like it was bizarre. That's the other thing I get nervous is I don't know when to freak out or not freak out because the other day she woke up with chest pain and she started tapping this like 5:30 in the morning. And she's tapping me, and then all of a sudden she's like getting up and like goes down on the floor,
Oh, geez.
falls out of
That's a
bed
bad one.
basically,
Okay.
and lays on the floor. But then I know because of previous times when it
It'll
happens,
pass.
in
Yeah.
like 2 to 5 minutes
she's okay.
She's gonna be okay, but at the same time, I'm like,
Yeah, it's freaky.
seconds and minutes count. So I'm like, if she kills
But I told him,
over,
I'm like, you don't need to panic
to
until
like
you see
due
you,
to my
like,
negligence,
like
you know.
get shot.
I mean, I've
Well,
broken
yeah,
a
so
lot.
here's the things I look for. So number one, for you, if you're feeling that way, don't get up.
Okay.
Right? Because you don't want you falling down again.
Yeah.
Right? Just, you know, don't
She tries to get to the floor though, like if
Yeah.
she.
There's something
okay.
about laying on the
This
hard
one. She
floor,
lays
like
down
the
and puts her
pressure
hands
or
down.
So do you
something,
like it? Feels better.
that it like makes
Feels
it,
better.
and I can get through
May-
it better.
Yeah, that may just be time, but yeah, fair enough. All I'm saying is don't get up into
Don't
a
get
standing
up.
position.
Okay.
You know, if you're lying down already when it starts. Number one. Number two is, again, she has a defibrillator device. If she has a cardiac arrest, it will treat her. Okay. Anything short of that, uncomfortable, not fun, etc., but not likely to be life-threatening.
I've broken lots of ribs.
So-
I used to when I was
Just
at
CPR
well, yeah, I
stuff,
worked
yeah.
with Mark Keep and stuff in the cath lab. And used,
You
But
see
I
that.
always tell him, I'm like, you don't have to do that.
Oh, I know, but-
She's talking.
but it makes me
Yeah.
nervous because I'm like, at what point?
You need
As
to-
an example, the other night,
Yeah,
her
she's-
mom was with us
she's
when she had
unconscious.
one.
Yeah.
Okay. And her mom's looking at me, and I'm just kind of like, and the kids are like, "Oh, mom's having," and I'm like, "Yeah, mom's having her thing. She'll be okay." My mother-in-law's looking at me like, "What the hell? Why aren't you calling 911 or something?"
Yeah.
You know, and I'm like, "She'll be okay," but at the same time, it's like
I know, it's tough.
there's this
Yeah.
balance between me looking like an inconsiderate a-hole husband
No,
or
you're
knowing
good.
that she's gonna be all right.
Yeah, no, it's just because you're actually medically sophisticated enough to understand what's going on. That's okay.
Yeah, I mean,
And yeah, she's conscious. It's okay.
well, I don't want to
right?
break no ribs. You know?
No. She'd have to be way unconscious for
Yeah.
a full minute or more, and then she would get, you know, if that were
Yeah.
significant, you probably would. It's possible you could have arrhythmia still slower than that, I guess. You know, if she was really having her, you know, if she was unconscious and stuff, that's a different story. But basically, there's no such thing as somebody having a terrible enough rhythm to require that who's conscious.
With
Okay.
the device.
Period. You know, anybody who's conscious is not having an acutely deadly arrhythmia.
Yeah, I'm
Okay.
not, I'm not
Yeah,
start
I-
busting her ribs or anything
No,
like that, but
I know.
but I sit there and I'm like,
I know.
shit,
It's-
is this it? Like I'm sitting there, and the thing that's terrifying for me is we don't know, like we're hoping like, oh yeah, this will knock 10 years or something off the back end of her life is what we're hoping for, or maybe not at all, but like when you see this stuff going on, like is this it? Is this
No,
you know, and it makes you
yeah.
panic because
I
she's
understand.
upset, she's terrified,
stressful.
she's like, is it
Yeah.
going away this time? Is it not going away this time? So it's just
I know. Well, let's
Do we
see how
call
this
them, do we not
goes.
call them?
You know, we can always go back and do more ablation too. I mean, even if you ended up, for instance, it is a choice, for instance, to ablate near that AV node area. If it turns out we end up making you pacemaker dependent, then we upgrade your device to a special biventricular pacing device, which will keep your heart muscle strong and this and that. You know what I mean?
Yeah,
So,
wanna do that
I think
right
you
now.
said
no, I know.
her
yeah,
her
yeah.
machine that you put in there. I think you said is the better one when you could add the lead if you had to, but you didn't add the lead. It just has the one lead, but it's capable of that.
Oh, maybe it is. Yeah, I
So,
can't recall.
the-
So
I remember you
yeah.
saying that.
The big reason why
Yeah.
I did.
Well, we could add the top wire, but I don't know if we could do the biventricular. But that's neither here nor there for now.
Right.
But that is the point where we could be more and more aggressive. The other thing is the next step we probably do ablation where we go to the outside of your heart too, right? And you know, because a lot of times sarcoid might be more accessible from there. And again, that's I do a bunch of it. You know, I actually did that 2 days ago, but you know, it adds percentage points to the risk of the
Right.
procedure, right? And so I think that all those things, you're so young, you know.